all of us experience those signs and symptoms from time to time. How do you know that more is going on just than the normal amount of bloating and gas, et cetera? Are there tests and specific treatments are available for SIBO?
The best way to do it is a breath test. Super simple, can even be done in your own home, and you just inflate these bags over a period of 2 hours after drinking a sugar. But it's really important to figure out which gas you have. What does that mean? The bacteria produce gases after eating food, and they can produce hydrogen, methane, or hydrogen sulfide, all of which humans don't generally produce. And so if you can measure all three gases, you can determine what type you have and then the treatment. But speaking about treatment, the primary therapy to get you started once you've had a positive test is antibiotics. You want to get the bacterial levels down, and then you want to keep them down, and that's sometimes where diet comes in after the initial treatment.
What changes can our viewers make to their diets now, today, to ward off these SIBO symptoms?
And we sort of call it low fermentation diet or low fermentation eating. You want to eat foods that humans digest. So things like fiber, things like legumes, things like non-absorbed sugars, which are the composition of many sweeteners that you use in your coffee, and even now in a lot of sodas they use these. They have 0 calories for you, but they're sugar for bacteria, and the bacteria ferment it a lot. And that's when you get all these tremendous symptoms. So you have to be careful with your diet. But the other thing that people tend to self-medicate with is prebiotics and probiotics. And those can be really helpful for some digestive conditions. But for SIBO, you already have too much bacteria. Adding more bacteria or fueling more bacteria, as with a prebiotic, usually I find that patients can get worse. And so you have to be a little more careful if you're using probiotics in this condition.
Well, you're coming up with this whole new SIBO versus IBS versus things going on in the lower intestines and the colon. This involves doing a little bit of differential diagnosis and consulting with an expert, because as you alluded to, the diet and the treatment for one may be a little bit different. We encourage fiber and things like that for the large intestine, where you're saying that potentially for the small intestine, it's going to give you symptoms of SIBO. So obviously you need an expert to sort through what is best for you.
Yeah, it's ironic. We're saying no fiber or low fiber, where
Exactly.
people think fiber is healthy, and it is healthy, but for SIBO patients, it's really difficult. And I sometimes tell my patients to eat white bread rather than whole wheat bread. But here's the thing.
Yep.
A very nice French baguette, a very nice Italian loaf, those are white breads. You don't have to, get the basic white bread. You can go gourmet.
Yeah, you're right. There are better choices. Listen, Doc, thank you so much. Dr. Mark Pimentel, you heard it here. We have to learn more about SIBO.